Dysautonomia is an umbrella term that refers to any imbalance or dysfunction in your autonomic nervous system. Your autonomic nervous system is the third part of your nervous system, the first two being the motor nervous system and the sensory nervous system. The autonomic nervous system's function is to essentially support those unconscious or subconscious activities that are constantly taking place in the background. So this can be your heart rate, your breathing, or your digestion. These are the three most common activities that are controlled automatically, and these are all looked after by the nervous system. Now, for a long time, we've realized that certain viral infections, maybe certain other bacterial or other parasitic infections, can affect the functioning of this autonomic nervous system, leading people to have a variety of symptoms. Now, when the autonomic nervous system gets dysfunctional, so dysautonomia occurs, you can have a variety of changes occurring in various parts of your nervous system, and especially those parts of the nervous system that are looking after your heart rate, breathing, and digestion. So specifically with referrals to the digestion, you can have bloating, you can have tummy becoming much broader, or you can have constipation or nausea or diarrhea as symptoms. You may also have loss of appetite. If you're affecting your breathing system, you can have a shortness of breath, you can have a cough or swallowing issues. And if it affects your cardiovascular system, you can have irregular heartbeat, or sometimes the heartbeat that can go up and down without any particular correlation to whether you're sitting down or standing up. These kind of changes can be disturbing, to say the least, and they can happen at any time. And when they happen after a viral infection, they can often aggravate the fatigue that is already happening. Indeed, we are actually thinking that when you have this kind of autonomic imbalance occurring within the nerves in and around your brain, it can also contribute directly to fatigue. And so in some ways, we are noticing that in patients with ME or CFS or even long COVID and some cases of fibromyalgia, dysautonomia is a very common presentation and can be seen sometimes in up to 50 to 70% of patients. It is something to be aware of, and it may not be directly related to CFS or ME, but it is something very commonly associated, and so we must do more tests to recognize it, to manage it, to make people, other professionals, the patient and their loved ones aware of the existence of dysautonomia and how to manage it. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.